Sleeping should be a no-brainer, right? Well, in fact, it uses a lot of our brain, and some of us maybe could be sleeping a little better. That's why I've called on an expert and my son's physician, Dr. Mariana Bedoya from the Monroe Carell Jr. Children's Hospital at Vanderbilt, to give us some expertise today. Dr. Bedoya, how are you? Welcome to the show.
Hi, how are you?
It's
my pleasure to be here. Thank you for inviting me.
Absolutely. Well, we value you so much, and I just have learned so much about sleep because of you. But I mean, really, this is something I feel like we've taken for granted. Why do you think sleep has just emerged so much in the news, with everyone from, professional athletes and sports psychologists to really putting a new focus on it, especially with our children?
Yeah, so honestly, I think sleep has always been important. I think along with nutrition and exercise, sleep is one of the 3 pillars of a healthy lifestyle. And I think especially now with the pandemic, of all the, different schedules and routines, and not having actually a routine is what makes sleep more difficult. It can give you difficulties falling asleep, staying asleep, and, just poor kind of schedules has made the insomnia worse over the past few years.
Yeah, let's talk about that for a minute, because that's one thing we learned from you, is that especially with having teenagers, and I know you're assistant professor in the pediatric department, when we think of, they go to school, they get up at a certain time, and then the weekends, that's when they catch up on sleep. But that's a myth, is that correct?
Exactly. So definitely it's important to have the good quantity, so enough hours of sleep. And exactly like you said, some people think, well, I can sleep 5 or 6 hours during the weekdays because I'm so busy, and then I'm trying to catch up over the weekend. Patients, teenagers especially, sleep 10, 12 hours over the weekend. And all the study shows that, you're not going to catch up. Just a few nights of poor sleep quality or quantity can, give you issues with sugar control, other hormones like hunger or feeling full with, with food, or obviously daytime activities like concentration, memory, and focusing.
Yeah, so before we get to what a healthy sleep schedule should look like, or some of the things we can do, what are some of the biggest culprits that are hurting our sleep right now, besides that, like you said, thinking we can catch up on the weekends?
Yeah, I think, like I said, 2 things are crucial. One is enough quantity of sleep, so enough hours of sleep. So kind of going like in a general way, school-age children should sleep between 9 to 12 hours, but then, teenagers should be sleeping around 8 to 10 hours of sleep. And most of them, they don't do this because they have to wake up very, very early for school, and they finish up very, very late, after sports or extracurricular activities or even homework. And then exactly like we talked about, this underestimation of the importance of sleep and having this good sleep routine, sleep hygiene, which we can talk about a little bit in detail after. And then technology, has pros and cons, especially now with the pandemic, a lot of things getting virtual, electronics, having that light exposure all the time is also giving you difficulties falling asleep or staying asleep.
Yeah, how long before we go to sleep should we be shutting that down? And I'm just asking for a friend, not that I have any problem turning off the TV or my phone, of course. But what should that timeline be to make sure we're getting that optimal sleep?
And that's a great question. I mean, it's really important. So the American Academy of Sleep Medicine, they recommend about 30 to 60 minutes before bedtime. Try to reduce that light exposure, any type of light, sunshine or lights in your home, particularly electronics like, tablets, phone, TV, that light, it can change your brain or trick your brain like into a more alert way. So it kind of blocks the melatonin. So melatonin is a hormone that helps us to fall asleep quickly and maintain good sleep. So we're exposed to that near bedtime. It can block that melatonin and give you that feeling, that sense of being alert. So I tell my patients about 30 minutes to an hour to avoid those electronics.
Okay, and we just have a minute left, but talking about that good sleep hygiene, I know you gave us a trick that really helped in terms of not just if you're going to bed at 1 a.m. all of a sudden going to bed at 10. How do you recommend people really change that sleep hygiene and that sleep routine before bed?
Yeah, so it's kind of hard to move our circadian rhythm, which is basically our inner clock. So patients who struggle, especially in the summer weekends, they're falling asleep pretty late. I recommend to move that clock slowly because it takes time to adjust. So if you have like a 3 or 4 hour gap that you want to move or shift that bedtime to an earlier time, I typically tell patients between 15 to 30 minutes every 5 days or so. Try to shift that bedtime to an earlier time. So within a couple of weeks, you'll go to your, desired bedtime.
Yeah, that's perfect. Dr. Bedoya, thank you so much for joining us today from the Children's Hospital. I know we'll be seeing you soon, and I want you to come back because I'm going to be showing all of you some simple ways and some products to use to be implementing Dr. Bedoya's techniques for all of us at home. Dr. Bedoya, thank you for joining us today.
Of course. Thank you for having me.